When it comes to coronavirus testing in Boston, as Mayor Walsh recently noted, Dorchester is number one. It does have the largest population of any Boston neighborhood, but the testing also reflects reasons to be concerned as well as impressed. To navigate that spectrum is the managing editor and publisher of the Dorchester Reporter, Bill Forry. Thank you very much for being with us, Bill.
Thank you, Chris.
At first, it sounded almost like a point of pride. Dorchester number one in testing. What's the good part about that?
Well, the good part is that we have the infrastructure here to do it. One of the things that Dorchester has in abundance are community health centers. There are 8 community health centers that cover various parts of Dorchester. Some of them overlap with Roxbury or Mattapan, but in the infrastructure we have here is impressive. It's also, a vital part of the health system of the city, not only in time of coronavirus, but at all times. And right now, what's been happening is the city has been helping these health centers step up their capacity. The Boston Resiliency Fund in particular has helped fund additional supplies and resources to places like Cobham Square Health Center, which has seen roughly a 70% increase in testing week to week since the city has assisted them. Harvard Street Neighborhood Health Center on Blue Hill Avenue is also stepping up their COVID-19 testing capacity. And then, of course, we also are home to Kearney Hospital, which has been testing in a pretty robust way since about St. Patrick's Day. So all of those health centers plus have kicked in to help with that. Of course, it's also the case that there are frontline medical workers living in Dorchester, first responders and law enforcement, and people who are working for places like the MBTA and others that I think is part of this story as to why there are more cases and more testing. First responders, as you know, many of them were kind of automatically tested earlier in this crisis. So I think all of those things contribute, but definitely the upside is that there is capacity. There are places, and these health centers are now testing not only people who are their patients, but anybody in the public who wants to go there.
Well, of course, the downside is how much this testing is needed, right?
Yeah, I mean, but the testing is needed everywhere, right? So, I mean, there's clearly been demand among, there are clearly cases in Dorchester at a slightly higher proportion than citywide. So we know that there's clearly a demand from folks who are feeling ill and want to be sure of what's going on. But it is important. And the city, the other thing that the city has done this week, as you know, Chris, is they've launched a random antibody study of 1,000 Bostonians, and they've targeted the Dorchester zip codes 02125 and 02121, which also includes parts of Roxbury. That's a deliberate strategy because they do know that the case levels there are higher than city average. They want to get a better sense of what's going on and to what degree our population is more impacted. And this antibody testing has been something that health experts have been hoping will happen to give us a better picture.
You mentioned infrastructure and the shift in mission almost at Kearney Hospital because they decided to really concentrate on the COVID cases. If nothing else, I guess that takes some of the pressure off all the other places that were going to be handling the surge, right?
It does. I think what's important to note about Kearney is that the Steward Healthcare System, which owns Kearney, decided to make that facility a dedicated COVID center for their entire regional system. That has since changed. There are other facilities that have come online. But we talked last week to Tom Sands, who's the president of Kearney Hospital. He said what was helpful about that was it really did give Kearney Hospital unique access within the Steward system to supplies and staffing and expertise from across the country, because Steward is now a national healthcare player. There were doctors flying in from other parts of the country to come to Kearney, help them get up and running, get on a kind of a wartime footing very quickly back around St. Patrick's Day. They were able to do so. What he told us last week, too, was they've seen a lot of success in moving people through, getting them treated, many of them on ventilators, by the way, and then discharging them. So they've seen good success in treating patients successfully there. And Kearney really is has now a specialty, even within Boston, in dealing with these cases.
Another thing we're hearing, whether it's from the mayor or people who work in the health centers, is that more people in the neighborhoods, if they go outside, need to be wearing masks, even these basic cotton face masks. And you wrote about a tailor, well, at least maybe one of your reporters did, a tailor in Dorchester who shifted her output, and she's contributing to, I guess, the solution here.
Yes, and this story was highlighted really by Councilor Andrea Campbell, who herself engaged with this tailor who has an operation on Washington Street, and asked her to make masks for her constituents. She's had to shift gears from making things like prom dresses and first communion dresses to making masks. So it's partly a business decision, but also a response to the demand in the community. We've seen it not only from small businesses like hers, and forgive me, her name, I'm zoning on it, Chris.
Julia de los Santos.
There you go. Okay. Julia de los Santos. People like Anissa Asabi-George, the city councilor, has also been making masks through the Stitch House. We focused some attention earlier in our news coverage on a young girl named Gabby from St. Brendan's Parish who was making them in her home. This is a bit of a cottage industry now that's happening everywhere, but particularly in Dorchester. And small businesses all over the place are having to obviously be innovative in how they approach this.
And one of the things I liked was that she's now hiring more people. And number two, some of these masks are going to some of the public housing developments where I guess people say, yeah, how can I get hold of one? Well, here it is.
Yes, and Councilor Campbell and other elected leaders have been distributing those masks that she makes and getting them in the hands of vulnerable populations, especially elders in senior buildings who are, you're right, they don't have another way to get them.
Another thing I noted about her, she's an immigrant. And we heard the president just talking this week about maybe we got to crack down on these sanctuary cities. How do you put those two things together?
Yeah, I mean, good luck to those who try. I mean, I think Mayor Walsh said it well yesterday in his press conference. He was asked the same question, and he basically just said, this is what this president does when he gets his back against a wall. And pretty clearly, all the polling suggests that the public has turned against him in larger fashion than before. So immigrants are an easy target for him and to his base, but people in Boston understand, that's a bunch of nonsense. And the new Americans, the new Bostonians who are very much a part of the city's everything, economic engine, our neighbors, our friends, they're doing what everyone else is doing, is responding and stepping up.
I know there's been a lot more grief than usual because of the pandemic, but also being mourned in Dorchester is a woman named Pat ONeill, a civic leader. Why do so many people miss her now?
Well, Pat ONeill was really a civic dynamo in a large part of the neighborhood. She's originally from St. Margaret's Parish up around the Polish Triangle. That's where she grew up. She's a Dorchester native. And then she and her family became very much rooted in the Ashmont Adams community back in the 1960s and 70s. She's been a civic leader there ever since then. She's led the Ashmont Adams Neighborhood Association. Pat, along with some other neighbors, started the chili cook-off, which is held every year, except for this year, unfortunately, to raise money for the Dorchester Day Parade. She was just behind the scenes on so many things and in front of the scenes in terms of organizing civic life in that part of Dorchester, around Ashmont Station, Peabody Square. That's where she's from. And her neighbors around that area in particular really miss Pat. She passed away last week. She had been ill for a number of months. She was 80 years old at the time that we lost her. And interestingly, this week, of course, public mourning is really not happening. There are no funerals, there are no wakes. But when Pat was laid to rest on Tuesday at Cedar Grove Cemetery, a large convoy of neighbors went through the cemetery to pay their respects, even though they couldn't get out of their cars. They wanted to be there to say goodbye to Pat. And there'll definitely be other ways that she will be honored in the weeks and months to come.
I also want to ask you about the evolution of civic meetings. And I go back to the old days with styrofoam coffee cups and cardboard ashtrays. Now it's on Zoom. What's it like?
Well, it's different. Everybody who's had to be, kind of thrust into the Zoom lifestyle knows it can be frustrating, and it can be at times fatiguing. But hey, it's a way to stay connected, and civic groups increasingly even just in the last week have started to really pick up on that. There were no meetings basically in March at all, and now in April and going into May, there are a number of new ones scheduled. Lower Mills Civic had their first ever Zoom meeting on Tuesday. The Greater Mattapan Neighborhood Association, Neighborhood Council, forgive me, is doing one next week. We just got notice of another one that's planned for next week as well in another part of the neighborhood. So we're seeing increasing traffic on that, and I think it's important. The mayor is jumping on some of these calls himself to talk directly to constituents. The mayor was on the call for the Lower Mills Civic on Tuesday. He happens to live in that particular part of the city and could speak very directly to his own neighbors about what he'd like them to do and what he's seeing himself. He's a little frustrated, as you noted, about people not wearing masks enough, and he communicated that rather forcefully to the neighborhood group.
I want to ask you about one thing finally, which is about looking at the path to reopening. I mean, there must be the spectrum here. Some people are desperate to get going right now, and some other people are still very worried. What do you see?
Well, I see people starting to plan for it, Chris. I think everyone agrees and is taking their cue from the leadership of Marty Walsh and Governor Baker that it's just not time yet. However, I think that thought is being put into, especially among restaurants, bars, other places that are eager to get back to work. And some of them have applied for, and some of them have succeeded in getting payroll protection funding, for example. If those can get online, they'd like to be able to pay their workers. They kind of have to as part of the provisions of that plan. And so they'd like to find a way to get reopened, even if it's at a much smaller capacity. All the signals we get from the Walsh administration is that it's too early to even go there, that we're looking at June, we're looking at the summer at this point in terms of gradually coming back to some kind of normal. But right now, I think what people are doing is anticipating that, getting some planning in order, and hoping for the best.
We should finally mention you're doing a great job keeping things up here with the news flow. So if people want to follow that, what's the best way to get on board?
Thanks, Chris. So are you. You can follow the Dorchester Reporter on Twitter @.news, or you can go to our website, .news.com. And by the way, we are still printing the paper and actually putting out a slightly larger volume every week, going into senior citizen homes, etc. So a lot of people have been subscribing, and you can find out how to do that as well at .news.com.